Today's video is about the best exercise for low back pain. And there is a best. And it's also my favorite. And there's a reason. But that best is the squat. The squat, and really the squat is an advanced back pain exercise, so you don't start with the squat. What you start with is, well, you start with bracing. We talked about that last week, but to start to incorporate the squat into your exercise program, especially if you have back pain, you have to start with the hip hinge. And the hip hinge is where you learn to use your hips instead of using your spine. So the question is, why is this the most important? It's the most important because it really solves two of the main problems that you have back pain. It's one of the 6 fundamental movement patterns that you have to ingrain into your sort of habits. Because when you do things wrong, that's when you develop problems. And it slowly will help you develop this pattern. And as you develop the pattern, you're less likely to do the things that make your back pain worse. And what are they? Number 1 is bending wrong. When you bend wrong, what happens is when you bend using your spine, there's a certain number of bends before that disc starts to break down. And as it starts to break down, it'll become painful. It could start with a bulging disc, which hurts a lot. And then it could progress to a herniated disc, or a ruptured disc, which is a form of a herniated disc, or a degenerated disc. It's a slow, progressive breakdown. So part of what it solves is the bending. But also what happens is in our culture, we sit a lot. And when we sit a lot, what happens is the glutes will slowly turn off. And the reason they turn off is because the hips become overactive. When the anterior hips, which is the hip flexor, sorry. When the hip flexor is very tight, it neurologically causes the glute to turn off. It's called reciprocal inhibition. It's a big problem. A lot of people with back pain have really weak glutes. You want to start to eliminate your back pain, you have to activate the glutes. And the way you do that is you start with the hip hinge, and then you ultimately start to progress to the squat. The squat is an advanced exercise. And it really depends on what kind of back pain you have. And not every back pain is the same, which is what happens sometimes is you get treated the same. A herniated disc very often is treated the same as a bulging disc, which is treated the same as a degenerative disc, and each one has its own specific needs. So it's not one size fits all. But the goal really is to be able to identify the difference between hip flexion and spine flexion. Some people it's really easy, and some people they cannot figure it out. Eventually you can figure it out, but the way you do that is with the dowel, which is the hip hinge. Okay, we've gone through this before, but this is kind of what it looks like. You have to develop the habit in your hips to bend using your hips, not your spine. When you use your spine, you're bending like this. When you use your hips, okay, you're bending at the hip. Spine motion actually will cause the breakdown. So you have to develop the ability to identify the difference and then ingrain that into your nervous system. Develop it as a habit. Bad backs, back pain is the result of bad habits. You don't realize it, but if you're bending wrong and you're picking up things wrong and you're sitting wrong and you're getting in and out of the car wrong, these are all things that will cause the breakdown of the disc. And that's what you're trying to avoid. Again, what happens, jelly donut, disc is like a jelly donut, all the bending, lifting, twisting, sitting, all those things will slowly start to cause the tear. And as it tears, all the activities that you do that bend more on that aggravate it more, which leads to the inflammatory process, which eventually causes the back pain not to go away. You develop chronic inflammation, which is a whole other problem. But the disc will start to degenerate. You'll develop the herniation. Eventually what happens is the disc comes all the way out to the outside. Okay, and then you develop the herniated disc. And there's a very specific way to treat the herniated disc. Again, the squat is not the first exercise. The squat tends to be the last exercise. Every back pain has a cause. You have to identify the cause and treat the cause. That's why everybody is different. Not all back pain is the same. There's a lot of different reasons. And people have different habits. And people have different problems with their disc. And each one needs to be treated differently. That is what we do. We eliminate the problem in the disc. We have the ability to solve all levels of back problem. The most severe and the most simple. Okay. When you solve the cause, the pain goes away. I talked about the bracing. I did a video not that long ago about bracing. Bracing is where you activate your core. Okay, like somebody's going to punch you, you activate those muscles. That's bracing. Bracing. We're not going to punch you though. There's no punching. So that's it. Exercise is the squat. Now, it's not the first exercise, it's the last exercise, because you have to ingrain the movement patterns, you have to develop the bracing, you have to eliminate the pain. As that all starts to get better, then you add the squat. Again, if you have not seen a doctor for your back pain, you need to see a doctor for your back pain. And you have to be able, if you're going to do these exercises, you have to talk to a doctor and make sure you can do the exercises. These videos are for educational purposes. This is not a treatment plan for you, nor is it a diagnosis, okay? If you have back pain and it's not getting better, you call us at 888-959-6816. If you have a problem in your disc and your back pain's not going away, we can solve it. My goal is to eliminate back pain from the planet, and we can do it. One disc and one spine at a time. That's it. Be careful. Drive safe. We had snow.